Alcohol can increase the desire for sex as it decreases feelings of inhibition. It can also decrease the level of sexual arousal during sex, the pleasure gained and the ability to have an orgasm. This is sometimes known as brewer's droop. It can increase the desire for sex as it decreases feelings of inhibition. Some women report an increase in the level of sexual arousal during sex. Others report that it takes longer to orgasm and that the pleasure gained is lessened. As alcohol lowers inhibitions, we may make sexual choices that we would not when sober. This includes choices about sexual partners, sexual acts, and using reliable contraception. If you are drunk and uncoordinated, it can make it difficult to put on a condom correctly. Only condoms will protect against both a possible pregnancy and a sexually transmitted infection. As alcohol lowers inhibitions, some people may add more alcohol to your drinks, also called spiking. Be aware of what goes into your drinks. Remember that if someone tries to have sex with you, you always have the right to say no, drunk or not. Firstly, if you are ready to have sex, be prepared. Always take enough reliable contraception with you and don't depend on someone else to do it. Only condoms will protect against both a possible pregnancy and a sexually transmitted infection. Secondly, make decisions about possible sexual activity before you drink alcohol and what your boundaries are. Discuss it with your sexual partner. Finally, if you do have unprotected sex, get emergency contraception, also known as the morning after pill, as soon as possible and certainly within 72 hours. Also, make sure that you go for an STI test. Many drugs, including alcohol, lower our inhibitions and heighten our body's sensitivity, even enhancing an orgasm. We might also become more sexually aroused and adventurous. This means that we might try more things sexually than we would normally choose and regret it later. It may also mean that we leave ourselves more open to contracting a sexually transmitted infection. Some men who have sex with men use drugs such as ketamine, speed or crystal meth. When put directly on the rectal area, it lets men have rougher sex and for longer. This will numb and irritate the skin, making it more likely that infections could be passed on, including HIV. Poppers open blood vessels within the rectum and relax the anal sphincter, allowing for longer and rougher anal sex. This, however, means there is a greater chance the skin could get sore or tear, allowing infections to be transmitted, including HIV. Some drugs, like amphetamines and alcohol, often make having erections and orgasms more difficult. Taking Viagra or similar medications with other drugs is risky, as they may put added pressure on the heart. Long-term use of some recreational drugs can lead to a loss of sex drive and the ability to get erections. This is not recommended. It may create a pleasant numbing sensation, but contaminants in the cocaine may damage exposed areas. Cocaine may increase sexual arousal for some people. For others, it may delay an orgasm or make it less pleasurable. Cocaine dependency is linked to a large decrease in sexual drive and activity. All drugs can alter our perception of the world, overstimulate and cause us not to think as we would normally. We are therefore more vulnerable at that time. People plying others with alcohol and getting them to engage in a sexual act without their agreement later is rape. Be aware of what goes into your drinks. Remember that if someone tries to have sex with you, you always have the right to say no, drunk or not. Certain drugs have also been used in a similar way. Rohypnol, often known as Roofie, or GHB, sometimes known as liquid ecstasy, have been added by people to drinks as a way of preparing someone for a sexual act they do not want. This can lead to a prison term up to a maximum of life. If you think this has happened to you, immediately contact the police or your local rape crisis centre.